Mother Knows Death, starring Nicole and Jemmy and Maria Q. Kane.
Hi, everyone. Welcome to Mother Knows Death. On today's episode, we're going to be talking about some celebrity cosmetic surgical procedures, a baby who was found in a horrendous animal hoarding situation. Talk about raccoons, dead goats. Yeah. A doctor who was giving chemotherapy to healthy patients just to make money off them. Real nice. A man assaulting someone after an offensive bodily function. Medical kidnapping, and a very unusual reason why a woman was denied a mammogram. All that and more on today's episode.
So we'll start off talking about your favorite celebrity ever, Chrissy Teigen.
She annoyed. I don't know. I don't even know. Like, what? Why is she even famous? Like, what has she ever done?
She's a model.
Oh, whatever.
She's married to John Legend.
Yeah, I could care less. I think that she looks like deformed, and I can't believe more people aren't just like, what did this chick do to her face?
So she, quote, accidentally, like, major eye roll, posted on Instagram Live while she was, like, her whole head was wrapped. She clearly just had a procedure. And then she went off and...
This is exactly why I can't stand this chick, because how do you accidentally post on Instagram Live? I don't even know how to do it if I tried.
Well, because you can't, because you're banned.
Well, I'm banned for 360 days, whatever, but like before,
I mean,
where's the button?
I've never accidentally gone on live. I see the button, but I've never hit it, and like I'm always hitting stuff by accident on there. It was totally strategic, because then
she so happened to be looking in the camera too, like
smiling, like, okay.
Do
you know what I look like when my camera accidentally opens? I have like quadruple chin. Have I always been this hideous, like horrible angles? Not like, oh, super accident. I just happen to have my phone held up and I'm smiling with something wrapped around my head.
What? And then like everybody's like, what is that about? Which I roll exactly.
So of course, you know, it's all over TMZ and like all the press, because people screenshotted it and everything. And then she came out later and said she had a hairline lowering procedure because she lost a lot of her front hairs from having babies, and it's very thin up there.
Well, yeah, I mean, that could happen. It's kind of a cool surgery they can do if your forehead is too big or if your forehead is too small. You can kind of cut it and make it shorter or longer, which is pretty interesting.
So all right, so they cut your forehead and then they move the skin. That's how they do it?
Yeah, like, so when I take out someone's brain and I make an incision from ear to ear all the way at the top of the head, I could essentially just pull their skin right off of the front of their skull. Like, it just peels all the way down very easily. So with that theory, you could either pull it back to make the forehead bigger, or you can take it from the top and pull it down to make the forehead smaller. So they make an incision right along the hairline. So if the scar heals nice, you won't even be able to tell. And I think that there's like lots of celebrities get this done. Like, I think your girl Teresa Giudice definitely got it done.
Well, I was gonna say that because she had like a 2-head. It definitely.
Dude, Lucia's got that. Like, they laugh about it so much. Like, that Lucia's forehead is like seriously one finger, one finger, and it's one of her fingers. So that's like a pinky finger of an adult.
It's not that bad.
Yeah, it really is. It really is. It's so cute. It's so cute though. It's like my favorite thing is her little fuzzy forehead. But Lillian's is kind of small too, though, honestly. Like, I'm just like, it's not as obvious with you because Lillian's got like is fair skin and fair hair, and you can't see it as much as you can on Lucia.
Well, is that from Gabe's side? Because you kind of have a big forehead now that I'm looking at you.
I do have a big forehead, but I think it got bigger as I'm getting older. I think my hair is falling out, and also like the Botox like really like.
Is it because of you've had all these babies and it's
that's why.
Up there?
That's why, yeah.
I mean, the thing is she is very open about all the procedures
she's not open about all of her procedures.
Not all of them, but
what did she do to her face? Because her face looks crazy to me.
She has clearly way too many fillers, and then she had the buccal fat removal, which I think is the worst surgery. It ages so many people. I don't think it ever looks good when people have that removed. So I would say
like Miley Cyrus got that done, and it looks like weird.
everybody
I'm not
looks,
into it.
you know, like obviously people are going to be annoyed by the way we're talking about people right now, but like I've gotten into a new phrase lately where like look at Bill Belichick's girlfriend for example. She's 24 years old. So I said to Ricky, she looks good if she were 50. She doesn't look like a 24-year-old. She looks like a 50-year-old that had good work done.
Well, maybe she's trying to look older so she doesn't look as young next to him.
But
I
this
don't
is
know.
no, this is how it is today. I'm like watching Secret Lives of Mormon Wives. These girls are all my age, and I'm like, they look 10 years older than me, and they've had so much work done on their faces.
All
It's
right, but
crazy.
that's fine. Like we could sit here and talk about how terrible some of these people look, but there's been a couple people that have come out this month that look really freaking good.
Anne
My
Hathaway,
number
number
one
one.
person is Anne Hathaway. Like, if you're listening right now, which I know you're not, but if you are, like, who is your surgeon? Because I will mortgage my house to go to them. For
Then
real, she looks so good, and so does Lindsay Lohan.
Lindsay Lohan and Kris Jenner looks pretty good with her latest facelift.
See, Kris Jenner looks really good. However, I don't trust their photos that they release. So, although she probably looks better, I want to see what she looks like in real life because they Photoshop their photos so much. Like, you know what I
Yes.
mean? Like, it makes me be like, does it really look this good, or is this just because you Photoshopped the shit out of it too? So, but I agree. It looks, because she was starting to get a little like Michael Jackson-y looking. You know, she was getting that weird like look.
Well, because everybody that gets so much plastic surgery like that starts getting the very specific look where you're like borderline scary looking because like you're
there's
just
this
doing
other
so much.
there's all these photos going around now too of Jeff Bezos' girlfriend,
Oh,
Lauren
Lauren
Sanchez.
Sanchez.
And like what she looked like before and after. And I don't know if like the before picture might be because how old is she now? She's like my age probably.
I think she's in her
50s?
early 50s. I mean, I think the problem is you start off small, you get some Botox, you get a little filler, and then you start getting carried away, and then that's when you end up looking in that territory. Because I think Lauren Sanchez was so incredibly beautiful, and it just looks like she's overdone it with the injections.
Yeah, like it really does. And it just is sad to me that doctors, because I know that a lot of times people be like this and that, and like speaking of Dr. Dimitri who does my Botox, and he would be like, no, I'm not doing it.
Well, a good doctor would turn you down. I actually have been seeing a lot of articles lately pertaining to Lauren Sanchez being like, who the hell are this lady's doctors that are like leading her in this horrible direction?
Yeah, because I think a lot of times with these types of things, you always have the issue that women are having some kind of body dysmorphia and they don't think their lips are big enough or this or that, and then all of a sudden it's like, it's like gone too far, you know. And I
Yeah.
think that's like Chrissy Teigen with the cheeks. Like you look at pictures of her when you're younger and you're like, okay, she has big cheeks. Like she's a big cheek person. But I don't even know what's happening now. But when I first started seeing, because you know, like you're all into the movie stars and stuff. I'm not, so I don't even know who these people are. And I first saw a picture of her and I was like, why is no one addressing this right now? Like she looks really abnormal to me.
Well,
That's how some of these people are looking like abnormal.
Well, for a couple years, people thought she was the most amazing person ever until it came out that she told Courtney Stodden to kill herself, and then all these other horrible tweets were coming out. So, like, she really hasn't exhibited nice person behavior on the internet. But I think the whole point of the story, whether we're talking shit about people getting botched injections or whatever, is that like she didn't accidentally go on Instagram Live and post it and just happen to look like that. I'm sorry. It's very strategic that you do something like that and you just so happen to be smiling and looking directly in the camera. And it's also not right up on her face. Like if you were like, I'm going to hold my phone up, for example. Like when I look at my phone, it's this far from my face typically, right? Like that's going to be close. This is very held out. Like
She has it on a phone stand.
yeah, it was just I just called bullshit. Like it's so strategic, and then like, oh, TMZ just happens to be writing about me. They haven't written about me in a while because I haven't done anything relevant recently. And I was getting a lot of heat for tweets that happened 10 years ago when I was a terrible person. So I don't buy it. I think it's ridiculous.
Yeah. And like I said, if anyone knows who Anne Hathaway's surgeon is.
Well, that guy's probably getting bombarded. She looks at. Lady Gaga had a good facelift the last couple years
Listen,
too.
and everyone has one. Like all these people like that say they don't, they all do.
Well, you could see
And that
because
that annoys the shit out of me. But like I like with the Anne Hathaway situation, I'm like, if that's where plastic surgery is going, like I'm into that because it's just like barely, it just looks like, oh, fresh, but like there's no, oh, she looks like a freak or anything. Like she just looks good. And so does Lindsay Lohan. Like Lindsay Lohan's the one that started that, I feel. Like
oh,
she looks
totally.
better now than she did when she was younger. And it's just like a refresh and it's just, it looks good. But like, how do you find a surgeon like that? That's just so scary. Like, because it's your face. You know what I mean? Like, I don't want to look like Lauren Sanchez. So,
Well,
like, I'll just age gracefully, I guess. I don't know.
I think
It's just tempting because Anne Hathaway, you're like, damn, that looks so good.
I would argue that these level of facelifts are in the like $500,000
Oh, I
price
know, yeah.
range.
They'll be like, yeah, your house mortgage is still not paid.
Because like for example, like so a lot of older women get facelifts, right? And it's like we look at Kathy Hilton and Martha Stewart side by side. They literally look like the same person. It's crazy. And I wonder if they go to the same surgeon because they have similar features in general, but I often get their pictures confused because they look identical.
Well, and Martha Stewart, she said that she gets Botox and filler, I think, but she's never admitted to getting surgery, but she's had surgery.
She's 100% had a
You know,
facelift.
you know what
She's
the thing
80
is?
years old. Like what?
I know, and they try to like portray themselves as being these superhumans that are immune to.
Like J-Lo and her olive oil
They're
bullshit.
just like they're immune to like everything else. Like they're not. They're like these like superhumans, and they're not the same as us, which they're not. I mean, clearly, but like. And you know in your real life, like there's all different ranges of people and how they look for ages, right? But there's always a range, and these people don't fall in the range even a little bit. So it's like, oh, you're just these superhumans that you don't get saggy neck and no wrinkles. Like, okay, you know, whatever.
Yeah, and I'm not judging people that get plastic surgery. I mean, there's definitely a bunch of
I'm
stuff
just
I'd
judging
like to
ones that
get
get.
done.
I'm just judging people that get bad plastic surgery. It's the same as, you know what famous people do too all the time? They get shitty tattoos. You're
All the
like, you have
time.
all the money in the world and you could call the best artist and be like, hi, can you come tattoo me and I'll pay you? And they would. And you go to like the corner shop and get the trashiest, worst tattoos, worst placement ever. And you sit there and you're just like, in this day and age, with all of the access that these people have, you just don't understand why they do that. So I guess the same could be said about the surgeries too. All right, let's talk about this couple who both abused animals and children.
Yeah, so this young couple was arrested in South Carolina after police found they were raising their 8-month-old baby amongst 47 animals, 6 of which were dead. And one of those dead animals was a decomposing goat carcass in a bathtub.
Raccoons, rabbits, dogs, chickens.
25 dogs, 3 cats, 5 raccoons, 6 chickens, 2 rabbits. So they said 41 total live animals in the house and 6 were dead.
Shit and pee everywhere. The investigators said that the ammonia from the urine was burning their eyes, and they find this little beautiful 8-month-old baby there. And they say to the parents, like, we're taking this baby away, and the parents just didn't even seem fazed by it. They must be on drugs, right? Like, what else? What is happening there?
Yeah, I mean, yeah, like what, like there's either severe mental illness or drug abuse going on because how could, if the police are saying it was burning their eyes just going into the scene, how are these people living in this 24/7? And then they said despite how disgusting the house was, the baby was in pretty good health.
Yeah,
Which
I
I
mean,
thought that was shocking, but
oh yeah, and they probably don't even realize that this is a child abuse, having your child in this situation. But the investigators were saying that animals shouldn't even be living in that kind of a situation. And I mean, some of them were severely dehydrated, covered in feces, matted fur, like all of that stuff. And you're just like, what is happening?
no, I have no idea.
All right. This next case is disturbing that a doctor would do something like this.
In Texas, this 68-year-old rheumatologist has been sentenced to 10 years in prison after falsely diagnosing his patients, leading to unnecessary treatments, including chemo, and he was doing this for 2 decades.
So I was trying to figure out what happened. So it looks like he put in $118 million in false claims to Medicare. And when he put in those claims, he received more than $28 million from the insurance companies. My question is, like,
Why
I mean,
didn't
this
this
is
get
probably
flagged?
this is probably how he got caught, I'm assuming, because he got greedy and like this is what they're going to do in Texas. They look at all the rheumatologists in the area and they're like, "Oh, this one put in $118 million in claims, and then this one with a similar size practice put in 20 million." Yeah,
$100,000.
like exactly. Like I can't even imagine it would be anywhere near that. And that, you know what, something similar happened. There was like this big healthcare scandal with my husband's health insurance for the state of New Jersey employees, and something similar kind of happened like that there was that the insurance company got keyed off because people were, they found a loophole to get cash out of it and they were abusing it, and it just looked absolutely ridiculous that all of these things were coming from just these certain group of people, right? It's the same kind of a situation. So I don't know how it went on this long, but
That's what I'm saying.
I mean, this is a long time. And so he got $28 million over the course of however many years. He had a luxury lifestyle with fancy cars, even a jet, high-end real estate, and all this stuff. And wait till you hear how disturbing some of these claims are. So patients were going into court and saying all of the side effects they were having from some of this toxic medication. So when you go to rheumatology, especially, and you're diagnosed with something like rheumatoid arthritis or lupus or something, they want to put you on some hardcore drugs sometimes. And this is like a benefit reward thing with the drugs. So they're just like, listen, like, we're giving you these drugs so you can have a better quality of life for your joints, or so your kidneys don't fail, or something like that. But some of these medications are extremely toxic, or they could cause such bad immunosuppression that you can get different kinds of weird infections, like we were talking about on the last episode, or one earlier this week, about these people that are getting histoplasmosis on vacation. So in this case, these people were saying that they've had strokes, necrosis of the jawbone, so their jawbone died, so that leads to lots of disfiguring surgeries, hair loss, liver damage. One of the patients, wait till you're screwed up this is, one of the patients showed up to court because she was given unnecessary chemo and now she's bedridden since she was 11 years old. He gave it to a child, an 11-year-old child.
This is where I think eye for an eye comes in, because give this motherfucker chemo unnecessarily
Yeah, like
for years of his life.
don't put him in jail. Just let him stay home and just give him chemo.
Because
Like,
guess
see
what?
how he likes it.
Chronic nausea and pains and any complications that come from chemo, I'm sure, are more torturous than sitting in a prison cell. So
Oh my God.
do it right back
Nausea
to
is
him.
the worst. And like all of it is the worst. Like all of this stuff. And you're just like, and the fact that they didn't need it, like he's ruined multiple people's lives and they will never get that back.
Yeah.
And it's almost like if you got it approved, like, let me just think about this a second. If you got the drug approved and were trying to give the medication to the people and stuff, I don't understand why you couldn't just say that the patient was going to take this medication and then, like, you actually, like, give them a saline drip or something. Why are you giving them the actual drug?
Because he's clearly a sick fuck. So, like, I
I
don't
know.
think he
I
was
just
thinking
like
about that.
I just think it's like, and this person like went to medical school and did a residency in rheumatology and like and practice. It's just like so bizarre to me.
And you're
And
telling me one day in his 40s, he just all of a sudden figured this out and was like, I don't care what happens to my patients. So you're probably a practicing doctor for at least 20 years before you start engaging this. What the fuck was he doing before?
he was probably doing it for a while, and like if he was doing it at half of much as he was doing it, he would never get caught. But the thing is that he got greedy, and how would he think that Medicare wouldn't realize this at some point? I mean, it took them a very long time, but, and the thing is that he has to pay back the money and he has to do this and that, but like, unless all of these investments he had actually has made him more money, then like he might not even have that money back. And none of that even matters, because like, you can't give people back their jawbones, you can't give people back their hair, you can't give an 11-year-old that you've destroyed, who's now bedridden, who had to be taken to court in a hospital bed. You can't give
Yeah, to
her her life
advocate
back.
for herself. How
Yes.
horrible is that?
Yes. And I'm like, listen, like I'm sure that was like mad drama and that was like one of the things that threw it over the edge for this to be proven, because could you imagine being a juror and seeing something like that?
No,
But like what a scumbag.
and when you're talking about jawbones, all I'm thinking about is the Radium Girls and how horrific that was. Everybody needs to read that book by Kate Moore. And if you're
Oh,
gross,
yeah.
remember we have an interview with her.
Yeah, that was so good.
Oh my God. That book is so deeply disturbing about like workplace negligence, poisoning.
Yeah.
It's
And
disgusting.
it has nothing to really do with this particular thing, but the dead bone and all of the disgusting side effects. I mean, when you have a jawbone that is dead, think about how important your jaw is. You need it to talk and you need it to eat. So
Yes.
that's a problem. And even if you could get reconstructive surgery and stuff, there's going to be periods of time where you can't eat for months at a time because of surgeries. And like, I'm sorry, but eating is a huge part of enjoyment of life. And if you're just getting a tube feeding, most people would agree that that takes away from your quality of enjoying life. And not to mention it's on your face and it can make you malformed. I mean, the whole thing is just so upsetting.
This episode is brought to you by The Gross Room.
Guys, I'm not sure what we're doing for next week's high profile or celebrity death dissection. We have a couple things on the back burner, including physician assisted suicide. Maria, what was that one you said you wanted to get into?
Yeah, I'm going to be doing a dissection on the Galvin family who had 12 children and 6 of them had schizophrenia. So we're going to look into that and how they were pivotal in schizophrenia research. It's a really sad story and it was a crazy book to read, and there's a docuseries too, so I'm going to kind of like condense like this 13-hour audio book in this docuseries and make it into a nice little article for you guys to read. But I think all our members are going to be really interested in that.
Yeah, and of course, like if anybody dies, then we're on it. So check that out. We also played what is it, Wednesday this week. So every Wednesday I post 4 different cases. One is a special effects makeup. The other 3 you have to guess what the injuries are, and then the winner could win a prize. And what's really cool is that a lot of the members make these really great guesses. Some guess it completely, or some make really educated guesses, which makes me just happy as a teacher person that that people are learning from what I'm teaching them. So that's super cool. And so yeah, check that out and you could win a prize.
Yeah, head over to thegrossroom.com.
All right. So, do you ever have a situation where like someone burps like really close to you and you could smell it, or they fart really close to you and you could like smell it or like taste it, like you feel like it's in your mouth and it kind of like pisses you off?
Yeah.
Well, I think that's what happened in this case, but instead like the guy took it to the next level.
Yeah, so these 2 guys were waiting in line at a plasma center? Like,
You know what? After you tell this story, we're going to get into those places.
all right, first of all, the next 3 stories all happened in Pennsylvania. So, like, of course, not shocking because it's not that far from us. But this first one, 2 men were waiting in line at a plasma center. One of them, which was an elderly man, farted in the line. He turned around and apologized to the guy behind him, but it wasn't good enough. And then that guy ended up assaulting him.
So the reason I say the plasma center is because like this place is like this would happen at a place like this.
What is it? I don't even understand. I see them popping up everywhere.
They're everywhere because they exploit poor people. That's what they do. It's really like a terrible thing. Like you go there. So I feel like the way that it's advertised, you don't really understand what's going on, because there's a big difference between donating your blood and your plasma and stuff to the Red Cross, who you're donating it, so you're giving it to them for like a juice box, and they're using it to save people's lives, right? There's a big
Yeah.
difference. These places pay people. They exploit poor people.
So
That's
what are they doing
do.
with it?
Even though they say they don't, it's like, well, they're using it for research, and they're using it for pharmaceutical companies.
Wasn't
they
there a story that some guy had gone like 50 times in 3 months?
Yeah, there's like a bunch of rules, but it they pay almost up to, if you are a regular and you go as often as you're allowed to, and there's all these stipulations because you can't have a tattoo or a piercing in a certain amount of time, and you have to be healthy, and you have to be over a certain weight. and you have to wait a certain amount of days in between. But if you go every single week as often as you're supposed to go and do it, you could make up to $8,000 a year doing it, which is a lot of money.
That is
But
a lot of
but
money.
like it's like that to me it's like it's just a gross that people would have to go there and give their blood in order to make that I don't know. The whole thing of it is just doesn't sit well with me. I don't like it. And they use it for whatever the pharmaceutical company wants to use it for. I feel like if you're going to do something like that and you want to do something like that, like obviously donate to Red Cross and stuff. So when people need blood from surgeries or anything like that or trauma, like
Obviously, you want to have room in your heart for an elderly person that toots in public, but at the same time, there's certainly
well,
people that don't have problems that do
well,
it.
also like the dude apologized, which I'm like, that's really nice because most people fart and they like act like they didn't do it, right? Like
Yeah,
people aren't usually like, oh, sorry, like right?
yeah.
He actually did more than any person I've ever been around. It's just I mean, listen, like I do think it triggers something in people for sure because it is disgusting to like, especially when it's like not yours or your family even. It's really gross and it could
You've
be
never, you've never considered doing it when somebody was standing really close to you that like wouldn't back off you.
like crop dusting them.
Like, you, my
I
thing
don't
is
know. I
like,
can't really fart on demand.
well, you're clearly not the Delco pooper. So, did you see she got like extra charges? And I'm
For
like,
what?
I forget what, but I saw something. I think we talked about she got charged with indecent exposure, and it didn't even occur to me at the time that if that goes through, she's gonna be on like a sex offender list, which is insane.
I don't think
Um,
she cares about what she looks like.
no,
Like she doesn't seem like this is any person. This would be a pretty embarrassing event, and she like had a viral video of her shitting on someone's car. And
she was proud.
listen, if that happened to my car, I don't know if the car wash could really like
Take out the
douche
trauma.
my car properly enough. Like,
Yeah,
so
exactly. When people are standing too close to me in line and I keep moving up and they keep moving up, then I'll open my phone and start typing a text that I don't end up sending to you or Ricky and it'd be like, this person's standing like in my body basically up my ass. But I feel like you could consider if somebody was standing super close to you, letting one rip so that they back off. But then you might get punched in the face, like in this case. But people need to be more aware of personal space out in public. Like, I don't want a stranger in my space. And it's not anything to do with like COVID or illnesses. I don't want anybody near me ever.
there's been a couple times that I've had to tell people that they're standing too close to me.
The 6 feet
And it's
apart
not like
thing,
you're at Disney World when you're like smushed. Like it's like sometimes it's like there's absolutely no reason this person is standing this close to me.
well, the 6 feet apart thing was awesome for a little bit because as somebody that doesn't like anyone in my personal space,
There was a
I'm
lot
like,
of good things about COVID. I'm sorry. Like I'm not complaining. Just there was a lot of good things. Getting out of doing a lot of things, standing apart from people, not having to talk to people, people being scared to talk to you. Like there was definitely good things about it. Now we have a really weird case to talk about, medical kidnapping. I've never even heard of this, but apparently, again, this happened not too far from us, that 48 people are involved with this lawsuit against this one particular doctor.
no, we've talked about a case similar to this. I'll get to it afterwards. But this doctor is being sued in Philadelphia for allegedly over-reporting child abuse and causing parents to lose custody of their 6 children. So remember we talked about that case of Maya Kowalski where she had that very bizarre rare condition called complex regional pain syndrome and that the doctors accused the family of Munchausen by proxy and then her mother ended up
Oh,
dying by suicide. So this is definitely something that happens, but in this case, I mean, there's 48 plaintiffs in this account in this lawsuit that are claiming it's medical kidnapping. They're showing up to court saying their kid was kidnapped. The kids are wearing shirts in court that says I was kidnapped. But this doctor has apparently accused all these families of the Munchausen by proxy, which is, do you want to explain what that is?
Well, that's like Gypsy Rose's story, basically.
She's the most famous example of that.
At first, it's supposed to be an extremely rare condition. And I think that a lot of people could look at people in their regular life and be like, okay, that kid, that parent has like a twinge of this,
Yeah,
right?
every
That they're
parent
like
you know has a twinge of it.
of it, that they're just like, oh, my kid's got stuff wrong with them and I'm trying to figure it out and this and that, because like a lot of times that's just kind of true and that happens, and it might seem like that because some kids are totally fine and then you're like, that whatever. But there's these extreme stories of like Gypsy Rose where a parent takes it to an extreme and like pretends the kid has cancer and gives the kid cancer medication and has the kid in a wheelchair when the kid's able to walk,
And
and
the
like
feeding tube and like all
feeding
this
tubes and
horrible
all this
stuff.
stuff. Yeah, just so they can get attention or pretend the kid has cancer, anything like that. So, so because the condition is kind of a rare phenomenon, it's very unusual that 48 people that had interactions with this physician have been diagnosed with it
Yeah,
first.
one doctor encountered 48
Yeah, which is
patients.
like, no, that didn't happen. And it's really scary because one of the people that are involved in this lawsuit said that his daughter missed several days of school, and the school called a caseworker, and I don't know if that's just protocol because the kid missed so many days of school, but I was thinking, like, remember when Lillian had walking pneumonia? She missed like straight up 2 weeks of school. Like she just was coughing so bad.
Yeah.
So I guess in certain, like in a public school situation, they could call a caseworker, and the caseworker was like, okay, well, can you just bring the kid into the hospital to get her checked? And at the hospital, they were like, yeah, you're not taking your child home. You have Munchausen by proxy. And in some cases, these parents didn't have their kids for weeks and even months. Like, how messed up is that?
Well, I think that's what happened in the Maya Kowalski case because she was separated from her parents for 3 months. And obviously, she's already going through this whole medical condition, and that's tough to deal with as a parent. And then you're being falsely accused of having Munchausen by proxy, and then you're separated from your child. It's too difficult to bear.
I can't even imagine. So I'm glad this doctor is getting sued. I mean, it's about time.
I
And
mean,
it's very cool that they
statistically,
found each other. Like, that's how bad it is that these people found each other.
statistically, that is outrageous that
It
one
it
doctor
is.
encountered 48 patients when this is like not considered to be not that common of a thing. Maybe you'd understand less than 5 in a whole career, but 48 that
Yeah.
at one time could file a class action lawsuit. I mean, this is ridiculous.
And like to the point where they need their children taken away. It is ridiculous. And you feel like you have like, even if you get exonerated and everything, like it doesn't matter. Like that's never that's a traumatic event for your kid and for you, you know?
Yeah, absolutely.
All right, another messed up case in the medical community is about this woman who was denied a mammogram for a very unusual reason.
Yeah, so she's posting on Reddit looking for legal advice. She claims she was denied a mammogram because she wouldn't consent to her photos being made public.
Yeah, so when you fill out the forms, the HIPAA forms and all this was a situation where it said that they wanted to use photographs or videotaped images or other images for the purpose of media publicity. And she said like, "Hey, I want to get this mammogram, but like I'm not checking this off because I don't want you to use pictures of my breasts for whatever you want to use them for. I don't consent to that." And then they said, all right, well, you can't get the mammogram if you don't check off the box. So then she consulted the legal department and they said, yeah, we can't change the wording on the consent form.
That's
So
ridiculous.
and so another woman had posted underneath of this Reddit forum that she had a similar situation when she had a breast reduction surgery, and she said that she couldn't get out of getting pictures taken. And then she said that she wanted to go to another doctor that wouldn't be making her get her picture taken, and her insurance wouldn't cover her going to another doctor, so she had to have it, and she felt like she was victimized. And I understand that. Like I'm like, when I just got my surgery 2 weeks ago, I was like, yeah, take pictures, and take pictures for me so I could show everybody. I'm like that. But if it was like my boobs, maybe I wouldn't be okay with that. And I like, I don't know if I just want random pictures of my boobs online like that, so I think that if you say that you don't want to do it, then they shouldn't make you do it.
They should be
That's not
getting
that
an
doesn't even seem like it should be legal, and I feel like it's just more of like the paperwork needs to be reworked because you're they're not asking you if it's okay. They're telling you like, we're not doing it unless you make it okay.
Well, it seems like a huge ethical concern, and like you're telling me they don't have enough patients that are okay with it to make up for the few that don't want it to happen. It's
Well,
ridiculous that you have to give permission for marketing materials
yeah, and
to get
that's
a
what I was gonna
procedure
say.
done.
Because let's say, for example, when you get an autopsy done, like it'll say like you're signing this thing, and just to let you know, we're taking pictures that might be used for medical education and this and that. And like, I honestly, I've never had a situation where a family was like, no, you can't take pictures for medical, for the record and for, but this is not saying that. This isn't, because obviously when you get a mammogram, they're putting your images in your chart. It's for your documentation of your record.
Do you think she's misunderstanding it? Like the form is that the pictures will be uploaded to her chart and the records, but she's thinking it's going to be used for marketing
I,
purposes?
I don't know, because the other person in the post said that the same exact thing happened too. And it's like, obviously, like for a mammogram, they're not going to use a picture of somebody's. They might though, they might use an actual imaging picture, because they're not going to take pictures of your actual breasts. So it would be like your imaging pictures, and they might just say like, you ever see those ads sometimes that like show this little tumor was found in this breast, and
Yeah,
it
but
shows
still,
like an actual mammogram.
if you don't want it out there, even if it can't identify you, you should be able to say that.
Yeah, I don't know. I do think the wording is a little bit weird, but I mean, I guess if you guys have ever had a situation like this, let me know. I mean, like I said, I'm pretty much kind of like, you could do whatever you want to do. I mean, it gets a little iffy with medical pictures, because if you use pictures of somebody's face or they have tattoos or something, then you could tell who the person is. But like honestly, if you're using a picture of a mammogram, like nobody knows it's you, then like who cares? But like I guess you have that right as a person to be like, you're not doing it.
Part of me feels like it was just a misunderstanding, but obviously with the climate of everything today, you could see how this happens as well.
Well, I
So,
don't know. I don't like the word that she used, medical or media publicity. Like that's interesting that she said that.
yeah, no, definitely. I mean,
Yeah.
it's worrisome because you should be able to get any medical treatment you need done and not have to worry about your pictures being posted on the internet. But
It is kind of funny though, like they hand you all those papers to sign, and it's like it doesn't matter like if you like you have to sign it. That's it. So like why are they even telling you to read it and sign it? Cuz they won't do it without you signing it.
yeah,
So it's like you're not really asking if it's okay. You're just telling.
yeah, because I was thinking like a lot of forms they don't give you until you're either there or the day before. So like when I got my surgery a couple months ago, what if the morning of they gave me one of those papers? Like I'm already prepped for surgery. Like what am I supposed to do?
Yeah, I don't know.
So I don't know. Well, thank you guys so much. Please head over to our Apple or Spotify and leave us a review, and head over to our YouTube channel and subscribe. And if you have a story for us, please submit it to stories@motherknowsdeath.com.
Have a good weekend, guys. Thank you for listening to Mother Knows Death. As a reminder, my training is as a pathologist assistant. I have a master's level education and specialize in anatomy and pathology education. I am not a doctor, and I have not diagnosed or treated anyone, dead or alive, without the assistance of a licensed medical doctor. This show, my website, and social media accounts are designed to educate and inform people based on my experience working in pathology, so they can make healthier decisions regarding their life and well-being. Always remember that science is changing every day, and the opinions expressed in this episode are based on my knowledge of those subjects at the time of publication. If you are having a medical problem, have a medical question, or are having a medical emergency, please contact your physician or visit an urgent care center, emergency room, or hospital. Please rate, review, and subscribe to Mother Knows Death on Apple, Spotify, YouTube, or anywhere you get podcasts. Thanks.